I'm Diana Quesada, and I run Dr. Lucier's surgery center as well as his front office, and I'm also his assistant in the surgical room. One of my jobs here is to assist Dr. Lucier and the patient sort of come to a place where they're both happy in terms of their size that they're choosing for the implants. And what I mean by that is, you know, patients sometimes come in and would tell me, I want this size, or whether it's a small size or a big size. And then again, they'll say, I want to be this cup. And so Dr. Lucier's job is to sort of gear them to something that's going to fit their body and that is going to actually fit in the space allowed to him. That combined with their idea of what they want to look like sometimes do not go hand in hand. So again, there is that education part that comes in where he will do the medical aspect of it, and then I will come in and I will what we call play with implants. So normally I would have, if I have a chance to talk to you beforehand, I'll have you bring a tank top just to kind of get an idea of what they'll look like. But I have different styles of implants that I bring into your consultation room, and then the patient and I discuss what look they want. I get a lot of answers. I want that fake look, that round up on top look. I get that I don't want people to know that I ever had surgery done. And then I get that I want to look as natural as possible. So it's my job to sort of look at what they're coming in with, what they want to look like, their frame. We spend, you know, some time in sizing. You know, we'll play with different implants. So I have different styles, different sizes. What I normally like to do is I pick two sizes, usually 25 to maybe 50 cc difference, and I sort of fit them in your body with a bra, and then I put your clothes on. If you're looking at yourself and just your bra, the implants are just gonna sit kind of funny. You're not really gonna get the look. And then we have you put your clothes on, and then it's more like, oh, okay. So if these were mine, this is kind of what they would look. They definitely have to fit your frame. They definitely have to try and reach that goal that you want in terms of, you know, cup size that you want to end up at. So we do a little bit of that, a little bit of, you know, playing with sizes. And then at the end of the day, if you don't really know which one is the bigger size, I am going to recommend you go a little bigger, just because most of the times patients are very nervous. They've never seen themselves that big. If you're coming in and you've never had big breast, you're going to be nervous that you're making a big mistake. And really at that point is a matter of trust. You've never met me, and you have to trust me that I'm going to give you the size that you want to end up with. And I definitely try not to push, but I try to encourage in terms of the size, what I think is going to give them the look that they want, and hopefully have them be happy with the size that they choose. So that's why I usually wait till the very end to tell you what size, because numbers usually scare people. So if a 350 makes, you know, Susie looks like a double D, a 350 is gonna give a B to somebody else. So it's not always the same implant is gonna give you that look that somebody else has. It's just, I recommend you come in with an idea of what you want to look like, what cup you want to look like, but never have the expectation of the implant size, because it might not be that look and it might not be that size that you end up with.